Studies show that 1 in 8 women will be diagnosed with breast cancer in her lifetime. It can be a very scary diagnosis, of course, at any age. Health blogger Diane Atwood joins us with a couple of questions that doctors most often get after a diagnosis. Good morning, Diane.
Good morning. Nice to see you.
Nice to see you too. So you've been talking with specialists, and they say there are a couple of questions that always come up. And I understand one of the first ones is, how did I get this, right?
Yes. Now, the specialist I talked to is Dr. Tracy Weisberg. She's a breast cancer specialist at New England Cancer Specialists in Scarborough. So yes, how did I get this cancer? Well, we don't really, even with all the research that's been done, have a clear answer of what specifically causes cancer. But what we do understand is that something happens inside a cell that causes it to not be able to die. It just keeps dividing and multiplying. Now, ordinarily, our amazing immune systems will get rid of those kinds of cells. But sometimes something goes awry and that doesn't happen. And that's when cancer may develop. Now, we do know about some risk factors, and we're going to talk about breast cancer. First of all, genetics. In breast cancer, for instance, we know about 2 genes, BRCA1 and BRCA2.
Right.
These mutated genes are passed on from one generation to the next. And something that's really important is that these genes aren't just passed on from female to female, like mother to daughter, but also the father can carry one of these genes and pass it on to his daughters.
And it's not a foregone conclusion, it just elevates your risk, right?
Right, not a foregone conclusion, absolutely. Age is a risk factor. The older we get, the more at risk we are for all kinds of cancers. Increased exposure to poisons in the environment. For breast cancer, hormones like estrogen may increase your risk. Now, women who start their periods at a young age, who have no children or who have lots of children may be at increased risk. And some scientists believe that stress can affect the immune system and puts you at increased risk of all kinds of illnesses, including cancer.
Okay, I know there's another question we want to get to, which is, could I have caught this earlier? Was there something I could have done other than, let's say, a mammogram to catch this earlier?
Right. So mammogram has been kind of the gold standard in the clinical exams. You should know your family history. You should know your own body so you're aware of the changes. If you carry a specific breast cancer gene, you should get a screening MRI, says Dr. Weisberg. And once you have a mammogram, find out, do I have dense breast tissue? Because if you do, it might be hiding a cancer, and so Dr. Weisberg recommends getting an ultrasound on top of the mammogram. And something fairly new that I'm going to be writing about on the Catching Health blog is 3D mammography.
Right.
Fairly new here in Maine.
Yep.
And available in some facilities, but it's especially probably good for women with dense breast tissue.
All
Again.
All right, a lot of information in there.
I know.
If you'd like to get more from Diane's blog, you can get a link to that from our websites, WCSH6.com or WLBZ2.com. All right, thanks, Diane, very much, helping us kick off Breast Cancer Awareness Month.
My pleasure.